Hello, I'm Dr. Heather Yost, and I just want to say thanks for joining me and taking the time today to be with us and watch this seminar. I do promise if you watch this seminar in its entirety, it'll definitely change the way that you view health, but especially the way you view the delivery system of healthcare today. So let me start with a question. I know that many of you are currently going to your doctors on a regular basis, getting your blood work done, taking whatever medications are giving to you. You might have even thought, I'm going to eat a little less food and try to eat healthier food, or started some sort of exercise program in a way to be more active. I guess the question is that all there really is to health? And when I ask that question to a lot of people, they typically answer, well, no, of course it's not. Because if it were, you probably wouldn't be listening to this seminar today. That's what's really important to understand. I mean, in today's world, things have changed. We have more toxins, we have more chemicals. The foods that we eat are not even really food in some cases. We take more medications. We're under more stress. I mean, even with all of the money that we have going into the healthcare system today, we're still not necessarily healthier. So therefore, the healthcare model in which we're entering really does have to start to evolve, change. Needs to understand there's some new complexities to what's happening and what's truly affecting our health. So that's why we're here. We want to explore and really understand, what is healthcare going to be in the 21st century? How can it be improved? Because I promise you, if your doctor's not taking into consideration the toxins in the environment or taking the amount of toxins that are in your body into consideration, it's something, or taking it as something that could potentially be affecting your health, they're missing something. I mean, something is being missed if we're not looking into that. We need to take into consideration the fact that you might have nutritional deficiencies, and in many cases, they could be severe nutritional deficiencies. If those aren't being addressed, you're just not going to reach your full potential. But let me back up a bit and explain who I am. As I said, my name is Dr. Heather Yost. I initially became a chiropractic physician. I met my husband at Iowa State University before going to chiropractic school down in St. Louis. He actually joined me down there. And after living in St. Louis for 3 years, we came back up to the Des Moines area and then I started my practice. So I saw a lot of people and helped a lot of people. But to be honest with you, there are many times that even though I was taking care of my patients' spines, I was still seeing them having issues and challenges that like autoimmune disease, that I just wasn't quite sure how to address. I mean, I saw a lot of people with thyroid issues. I was seeing people that needed to continue to take medication, things like blood pressure medication, cholesterol medication, fertility medication. I saw a lot of people having fertility issues. And even though some of that was being helped and resolved, there were still times that I felt like I was at a bit of a roadblock, not being sure what to do as I saw people continue to suffer. I mean, I knew there was natural means to help them. I just felt like I kind of needed more tools and more resources. So it's funny, I've always told people that when there's a question, you ask the universe a question, it will answer. And sometimes you don't see the answer until you're through it. But a couple of years ago, I started having severe joint pain. And it started in one area and moved to another. I mean, it affected every aspect of my life. I've defined myself pretty strongly as a runner. And my favorite role in life is being a mom. And mom is my favorite word in the English language. And those aspects of my life were being severely affected. I couldn't hold my son and have him lay his head on my chest because of front rib pain. I couldn't run because of SI joint pain. I couldn't roll over because of SI joint pain and rib pain. It got so bad that even though I was doing everything that I knew how, in the model that I had been using, I too became one of those people that I couldn't help with certain things. And so I ended up in a medical doctor's office, an MRI, and found some bone marrow swelling and long story short, I was up at Mayo for quite a bit of one of the summers and diagnosed with an autoimmune disorder and told that I needed an immunosuppressant drug. In the midst of all of this, I started seeking out functional medicine and started learning about functional medicine. And I actually started on a journey to become a board certified functional medicine provider, thinking that if I helped nobody but myself, it would be beneficial. And I think I'm only one of 6,000 in this country right now that are practicing, that are board certified. So I took my challenge and turned it into an opportunity, and my crisis into growth, and through functional medicine have changed my life. So I know that you've probably maybe never even heard that term before, but so many people have heard of Dr. Oz, right? So on his show, he has what he calls his Fantastic Four functional medicine practitioners. So these are actually medical doctors that were once practicing medicine, but like I like to say, have hung up their stethoscopes or hung up their lab coats and picked up the new scope of functional medicine. So what is functional medicine? To really put it simply, it's looking to remove the things in your body that aren't supposed to be there and put things in your body that you might be missing, like essential vitamins and minerals. So really what we're doing is we're looking to remove things like toxins, remove things like bacteria, parasites, food sensitivities, anything that's causing an internal stress in your body. And what we're looking to do is we're looking to replace it with the right amount of essential fatty acids, vitamins, minerals, so the body can begin to repair itself and become whole again. So let's look at this picture. This picture pretty much explains functional medicine. What we like to say is that there's a root cause to these problems. If these root causes aren't addressed, the symptoms will start to appear. And if you notice here, it's underneath the ground. Below the surface level is where these causes are. I think we can all agree that nutritional deficiencies cause illness. I think we all can agree that stress causes illness. We can all agree that toxins and a toxic environment can cause us to be ill. Poor digestion can cause us to be ill. So we have to look at these causes, because if we don't, eventually we start to see the surface. We start to see the symptom that we then address in our current healthcare system with medication or surgery. So a good example of this really is depression. I know this is going to sound a bit crazy question, but how many of you believe that depression is caused because of a deficiency of Prozac? I mean, I know that I'm not trying to be humorous, but it might sound a little funny, but if you really think about it this way, 1 out of every 6 women in this country today are taking some form of an antidepressant. If it's not getting to the root cause of their problems, why are they taking it? Now, I know there's a time and a place for it, certainly, but 1 in 6 is not what it used to be. So what is happening here? And now that we're also seeing research that's showing us that, and actually they've done 2 different groups of studies. They put one group on an antidepressant, they put another group on sugar pills. And after they did a long-term study, they found that the people that took the sugar pills over long-term had less depression and were less chronically ill than the patients that took the depression medication. If they're not addressing the true cause, I mean, why do we take these things? Well, because it helps with our immediate symptoms, correct? It's a Band-Aid that can help, but it's not something that's going to say long-term get us where we necessarily need to be. Another example is 1 out of every 3 Americans now over the age of 60 is taking a cholesterol medication. I mean, we know that we don't have high cholesterol because of a deficiency of, say, cholesterol medication. We know there has to be a true cause, right? The thing about it is there's not one particular cause of high cholesterol. And I'll go over that. I'm going to actually explain that a little bit more later too. There isn't one particular cause. But one of the reasons we have, or somebody would have high cholesterol, is because the body makes cholesterol. It's not actually what you eat. There's only 25% of your cholesterol levels are raised because of what you eat. But 75% of your cholesterol is actually because of what your body produces from its liver. What what's the body trying to actually do when it elevates our cholesterol? Well, that's what we'll explain more as we go through this. What's important to understand is if we keep addressing the symptoms, we're going to continue to suffer, because if we don't address the true cause, the problem will what? Get better, stay the same, or get worse. If we don't address the true cause, it's going to get worse. So that's what we see in our clinic all the time. When people come to us and they're on handfuls of medication, they've been suffering for years. They're not getting any healthier. We have to switch our paradigm and understand that we can help the body become healthy and whole if we just eliminate from the body what isn't supposed to be there and put in the body what it does need. Now, in our office, we like to look at the body as 4 primary systems. The body has, I guess, depending on who you ask, 11 or 12 different primary systems of the body. Unfortunately, many of us are used to going to practitioners that specialize in separate divisions of the body. For example, if you have a heart problem, you go to a cardiologist. If you have a gut problem, you go to a gastroenterologist. The problem with that is that our body's not actually separate systems. The systems of our body are all interconnected, that they all work together in harmony, and we're all really one entire ecosystem. But for practical purposes or for educational purposes, we like to explain the body as these 4 primary systems. What I'd like to say is that these 4 systems are the 4 core systems of our body. When one of these systems become out of balance or becomes damaged, it obviously is going to affect the other system. So if you have a problem with the hormonal system, it's going to affect the nervous system. It's going to affect your detoxification systems. It's going to affect your digestive system. You can't affect one of these without affecting all of the other systems. So realistically, that's why I can consider them all one system. But for today's purposes, we're going to go through each one of these and explain how these systems become broken and damaged, and then basically how they affect the other systems of the body. First system we're going to talk about today, it is the hormonal system. In the hormonal system, we're going to talk about your adrenal glands. I know a lot of you are familiar with the hormone adrenaline. Therefore, you probably kind of have a good understanding that when you're stressed, when you're under a lot of what they call attack, your body goes into a fight or flight system. That's when these little adrenal glands that sit on top of your kidneys start to release certain hormones like adrenaline, cortisol, epinephrine, norepinephrine. When this happens, what we start to see is a physiological change in our bodies. We start to see our bodies maybe have elevated blood sugar. We see our blood pressure go up. Why that is because, well, okay, let's just pretend a big bear jumped out of the woods at you and growled at you and scares you. Obviously, you're going to want to fight the bear or run from the bear. Now, if you're like me, I promise you're going to want to run from the bear. So when that happens, what does your blood pressure do? It goes up so that you have more blood in your arms and your legs. You have to have more blood sugar so you can run and be faster and be more active. Over time, though, what we see with these types of stressors is that eventually we develop what we call chronic fatigue syndromes, right? So you're not typically going to have a bear jumping out and scaring the living daylights out of you on a regular basis. But when your stress levels like that are up, your body doesn't know what's causing the stress or doesn't understand the difference between different types of stress. It just says, I'm stressed, and it continually causes these changes in the body, which eventually wears the body out. And sometimes we even see fibromyalgia develop. Now, the reason why we see fibromyalgia develop in sort of an adrenal fatigue case is because initially, I mean, if you're running from a bear, you could probably run a long time. You could run through briar patches. You're not going to feel pain until after you're done, and the cortisol wears off. Cortisol is an anti-inflammatory hormone, so it actually helps to sort of buffer or stop pain in our bodies. The other thing, and I sort of touched on this, but I want to make sure that you understand that stress isn't necessarily an emotional stress. Your body really doesn't understand the difference between different types of stressors. The physiological response is the same. So whether you're running from a bear, you're, say, driving in a big city, dodging potholes, rushing to work, or dealing with a spouse, children, or relationships, I mean, they're all stressors that we can encounter in our lives, but your body views them even though they're different, views them as the same. They cause the same physiological response. When you have these sort of hidden stressors inside of your body, when you have these things that aren't supposed to be there, like toxins or chemicals, hormonal imbalances, yeast overgrowth, food sensitivity, those are all hidden physiological stressors that can impact us and eventually lead your body into that sort of fight or flight. So that's why we're starting to see now also more people with anxiety, with depression. If you think about it, if you're under long-term stress, doesn't it just sort of make sense that eventually you're going to become depressed or become anxious? That's what our job is to help discover where these stresses are coming from and how to help you learn how to improve your situation, eliminate those stresses. And I'm going to show you in a little bit in the next slide how stress depletes some of your hormones that affect your mood. Also in this situation, you're going to crave salty foods, crave caffeine, crave carbohydrates. I mean, I don't know about you, but I'm a bit of a type A stress type. I've always sort of joked that what's too much for others is just right for me, but sometimes that catches up to me. I not only own this business, but I have 3 children and the same stuff that everybody has going on. And the way it affects me when I'm stressed out is I adore, crave, and love French fries. I love anything salty. And I mean, if I say bike into work and drive by Wendy's, I mean, I am salivating, just smelling the French fries. The salt is actually sort of a precursor to a lot of those hormones that are those adrenal glands release. So that's why you have those types of cravings. What I find a lot of times is you might have that craving for salty foods, but these people like me are also the same type of people that have troubles falling asleep, falling back to sleep, kind of people that go to bed at 10 but don't fall asleep till 11, wake up at 2, stay up from 2 to 3 or 3:30 until they fall back asleep. That's those adrenal glands. They're kicking in. They're becoming dysfunctional, becoming damaged. You have to watch that. So those people are also going to sometimes have anxious energy or heart palpitations, particularly towards the middle of the day, the end of the day, sometimes even the first thing in the morning. They wake up and they just have this anxiety about them and they don't know why. They feel like something's wrong. Eventually, if this stress becomes long-term, I mean, we know these people can develop heartburn, reflux, ulcers. It's kind of interesting to think about that because when your adrenals are firing, it actually shuts down your stomach. You've seen this and heard this before because I've said that stress causes ulcers. Or if I said like, hey, stress causes ulcers, you'd be like, yeah, it does. This is the mechanism and how these adrenal hormones actually shut off your body's ability to digest food. Stress can also shut off your reproductive system. What is happening is that it's shifting your body from the feed and breathe system to the fight or flight system. That's also why we start to see people that have a lot of stress when they go through menopause. They have a tremendous amount of trouble with their hot flashes and mood swings, and that's because the adrenal glands also release estrogen. As the ovaries produce less estrogen, the adrenal glands are supposed to come in and sort of be the hero. Many times we're able to help our clients that were once thinking they had to rely on hormone replacement therapy, but now once we're able to rebuild their adrenals, they find that they can go through menopause so much easier without the medication. I mean, obviously when you're under a lot of stress or when you're running from a bear, sex is the last thing on your mind, so low libido happens. When you have low libido, the next thing to happen is infertility. We always like to say that if there's no drive, there's no conception. Having desire to have sex leads to pregnancy. They've seen that actually in studies. Also, what we're seeing is when you're under long-term stress, it leads to irregular absent menstrual periods. What's great about functional medicine, I'll actually get to show you in the next slide how indeed your adrenal hormones affect your reproductive hormones. Look at the top left. See cholesterol up there? It doesn't come across very clear. So if you can see top left, it says cholesterol. Cholesterol, interestingly enough, a lot of people don't know this, is the precursor to every one of your hormones. Every hormone in your body is made of cholesterol. This is why cholesterol is super important for women, because they do have more hormones and more hormonal needs. Cholesterol eventually leads to progesterone. Interestingly enough, look down here towards the bottom though. Cholesterol makes progesterone. And progesterone is a precursor to cortisol. What happens is if you're producing a lot of cortisol because you're stressed, you're going to be depleting your body of progesterone. So you're going to have a lower progesterone level. That's kind of problematic in our society because what we find is that so many people have low progesterone, high estrogen, and that imbalance creates a lot of problems for conception, a lot of problems in your hormones. Understanding how this stress impacts your hormones is crazy important. So let's look at this next slide. Tyrosine. If you notice here in the middle, at the upper left, it's an amino acid called tyrosine. And tyrosine can either make epinephrine or norepinephrine, or it can make thyroid hormones over here to the right. What's interesting is that if you're making a lot of stress hormones, that's not going to leave as much tyrosine to make thyroid hormones. This is how your adrenal glands can actually impact your thyroid hormones. Also, if you look here at epinephrine and norepinephrine, if you're making a lot of those stress hormones, look right above that. You're not making as much dopamine. Dopamine is really important to help improve the quality of your sleep. So it's also one reason why it helps you have dreams. I bet you probably have noticed that when you were young, you used to have a lot of dreams, but now you don't have as many dreams. That's because of this cascade of events here that's leading to a depletion of your dopamine levels. The adrenal glands not only affect your stress hormones and your brain physiology, but it also affects your thyroid hormones. So that's what we're going to talk about next, your thyroid. Your thyroid is extremely important. The reason why it's so important is because every cell, tissue, gland, and hormone of your entire body has a thyroid receptor on it. This is the only hormone in your body that affects every other function, cell, tissue, organ, gland in your body, the only one. So when their hormones when their thyroid becomes dysfunctional, what we're going to be talking about today is when your thyroid actually starts to slow down. There are some cases where the thyroid speeds up, but that's very few cases. If that needs to be addressed, I can talk to someone individually about that, but it's not something we see very often. What you normally see is when somebody has a low thyroid, when that happens, they're going to gain weight all over. Their metabolism is going to slow down. They're going to have cold feet, cold hands. Their blood sugar is going to go up. They're going to become fatigued. They're going to crave carbohydrates. Their digestion is going to slow down, so they'll become constipated. They're going to start losing hair. They're going to have dry skin. It's going to lead to depression, anxiety. If you think about it, when women typically have menstrual cycles, they have mood swings. That's an example of our estrogen and progesterone and testosterone affecting. It affects your mood, but depression and anxiety can also be affected. Depression is one of the things that's a very common side effect of low thyroid. It's something we see in our office oftentimes that's missed when people are diagnosed as having depression, but really they just have a hidden thyroid problem they didn't even know about. You can see an increase in muscle aches, allergies, and infections, and that's because the immune system slows down. Heavy menstrual periods, a normal menstrual period should be 5 days long, light red, no clots. Oftentimes, what I'm finding is that it's not normal in this country, but that's what it should be. What we're hearing more that's more common is 7 days, clots, dark red, cramps, PMS. It's not an event that most women like to even go through. And that's just not normal, but it's very common. And common and normal are not necessarily the same thing. We also see that decreased libido because your hormones are slowing down. The thyroid affects those hormones as well. You become forgetful. You have high cholesterol. It's not very uncommon for us to see a thyroid patient come into our office that's been diagnosed with depression. So she's taken a depression medication, or he's taken a depression medication. They have sinus medications are taken. They have had menstrual problems, menstrual history problems. So they take birth control to help normalize their periods, which can actually cause more thyroid problems, which I'll explain here in just a second. They also typically are taking some sort of sleep medication because their sleep starts to fail too. What's happening is they're just not understanding that just because they're taking a Synthroid in some cases or a medication for their thyroid, it's really not addressing the true cause of the problem in so many cases. I'll explain what the number one cause of thyroid disease is in a second. And so it's causing those symptoms of the body to start shutting down. These things have to be addressed properly. That's our goal, is to understand what the true cause of someone's thyroid problem is and to help them restore their health. This slide's going to explain just a little bit more about how this works. If you look at the right, there's the pituitary gland. That's in your brain. That releases a hormone called thyroid stimulating hormone. Then it tells your thyroid gland to produce more thyroid, and that's called T4 thyroxine. T4 is actually inactive. That T4 goes to your liver, kidney, and your gut. I'm going to say that again if you think about this. Your thyroid releases T4, does nothing for your physiology. It doesn't improve your metabolism. It does nothing until it goes to the liver, kidney, or gut. And it gets converted to T3. Think about this for a second. How many times have you thought that maybe your thyroid problems were not really a thyroid problem? And maybe it's because my liver, kidney, and gut aren't converting into this T3. Bet you've never thought about that until this moment. That's something to understand that our clinic's really stressing, is that we can't just look at one gland or one organ. You have to look at all the different systems of the body and how they're interconnected. If you look at this, most doctors only test the thyroid stimulating hormone. That's up here in the red. And the T4, that's in the red, but they're leaving out the T3. They're also leaving out something called the reverse T3, which can be a stress hormone. This is where your body makes thyroid hormones. Instead of T3, when you're under stress, it's going to make reverse T3. When there's inflammation in your body's going to make reverse T3. Understanding this reverse T3 can also be really important to understanding this picture. So once this T3 is made, it goes to this cell, tissue, organ, gland, and hormone, unless it's stopped by a protein. The protein that we can measure also in our office is called thyroid binding globulin. Just think about the words for a second. Thyroid binding globulin. What it is globulin's a fancy word for protein. It's something that binds up your thyroid gland. It's a protein that binds up the thyroid hormones so that it can't get to that cell, tissue, organ, gland, or hormone and help to create the desired effect. Now, what makes this protein go up and slow the thyroid down is cases where we have estrogen. Many women that I know of are on birth control. Some birth controls actually have estrogen in them. That can become problematic because it can actually affect these proteins that make the body make more proteins. Try this. Google T3 uptake or thyroid binding globulin in association with birth control. There's been a big link that's been noticed with that. Birth control is also a toxic substance. I know it seems crazy to say that a hormone is toxic, but I want you to think about this. Let's say you drink alcohol one day. How much alcohol would it take for you to drink to kill yourself? I mean, it'd probably take a lot of alcohol. So that tells you the kind of level of toxicity of alcohol, how sort of potent it is. Now, how about ibuprofen? How many ibuprofen would you have to take to kill yourself? It's really not that many. The same thing can happen with birth control. If you took too many birth control at one time, it could actually kill you. In that sense, this is a toxic substance because it's unfamiliar to the body, and the body in the liver has to process it. I mean, anytime we take any medication, it's going to cause some liver dysfunction or liver stress. That's going to lead to more protein uptakes, and that's what we're seeing a lot in the office. Lastly, adrenal hormones, that stress makes these proteins also go up. That's something else we want to look at and understand. The last thing, the most important thing to understand is that the number one cause of thyroid disease, is Hashimoto's. It's an autoimmune disease that actually attacks the thyroid gland and stops it from making thyroid hormones. The problem with this is that many people that we find in our office probably about 60 to 70% of our patients come in with a diagnosed thyroid condition that are actually taking thyroid medication. Then we go along further, do more testing, and we find out that they have this autoimmune disease, and they never ever knew it until we diagnosed them with that. This is a huge problem, because if you think about it, this patient doesn't just have a thyroid problem, really they have an autoimmune system problem. And if you really think about it, with an immune system, where is the majority of your immune system found? The majority of your immune system is actually found in your gut. So you don't really have a thyroid problem, you have a gut problem. And if you don't address the gut health, then the autoimmune disease is going to get worse and worse and cause more problems. This is something we do for all of our patients. For all of our patients, we always test for Hashimoto's. I've even been tested for Hashimoto's, and I know I don't have an autoimmune disease like Hashimoto's, but the problem is that I want to figure out if I do have an autoimmune disease before it becomes a problem. So that's what we're testing for. I mean, you can have autoimmune disease for years before symptoms start. The next cause of thyroid disease is that we see that's very common in our thyroid conditions. It's toxins. If you see her on the left, the thyroid gland, that's that little butterfly shape, secretes a hormone, and it goes to the receptor in a cell. If that takes place, that's what increases our metabolism. It increases our mood, improves function of the body. But what can happen is that these toxins can get in the receptors and inhibit the thyroid hormone from getting into the receptor itself. It's very common today, especially if you look at different chemicals like bromide and fluoride. Those are two of the most common toxins we're starting to see that affect the thyroid and the thyroid function. The next hormones that we're going to discuss are going to be those the reproductive system, so estrogen, progesterone. What happens so commonly these days is that there's a deficiency of progesterone and there's an elevation or an increase in the amount of estrogen in people. Remember, as we discussed earlier, that stress can play a part in that, and that there's some other factors that we'll go over in a second. When this happens, when you create this imbalance, your libido goes down. We have abnormal cycles, like we mentioned earlier. We're going to have infertility issues, moodiness, irritability, anger, rage, sleep issues, anxiety issues, and so on. So often, especially as women go through menopause, they start to develop sleep issues and anxiety as their hormone levels start to sort of taper off or get imbalanced. Getting the balance of progesterone and estrogen is really important. Progesterone's more of the relaxing hormone of the body, and estrogen's more the excitatory hormone. As you get out of balance, you can see how it can start to create these types of symptoms. Once again, though, even more important than symptoms is understanding what causes these symptoms. What research is starting to show us is that a very common cause of estrogen dominance is xenoestrogens, or it just means they're chemicals that mimic or act like estrogens. We're finding that these chemicals now, we're finding them in lotions that we're using, in shampoo, deodorants. You've even heard probably some commercials or advertisements for lotion, shampoos that are paraben or phthalic free. These are especially important chemicals because they're such endocrine destructors that they can mimic estrogens. We also know that our body fat can create estrogens. The more body fat you have, the more estrogen you create. The problem with that is the more estrogen your body has, the more it takes that estrogen and stores it in the fat to protect itself from those high levels of estrogen, because the higher levels of estrogen, the more likely we are to develop estrogen-related cancers. Another thing that we're seeing too is that birth control can lead to an imbalance of estrogen and progesterone levels. I think we might have mentioned it earlier too. That's what a very common side effect of when people start taking birth control is that they gain, say, 15, 20 pounds in some cases because of the imbalances in our hormones. We also know that like we mentioned earlier, stress can cause a lowering of progesterone, which then makes estrogen appear to be higher. Even if estrogen's normal but progesterone's lower, it's still an imbalance that can create these hormonal symptoms. We also know that high insulin levels can create an imbalance in your progesterone and estrogen. I mean, I know that many of you you might not be familiar with insulin, but insulin's the hormone that helps you regulate your blood sugars. The more sugar you eat, the higher your insulin levels. So let's look at an example of a 13-year-old girl. When she first starts having her menstrual period, it's heavy, it's long, it's crampy, longer than 7 days. It's just not really a good event for her. Obviously, when there's these types of problems, gosh, as a parent, all you want to do is help. So you bring your daughter to the doctor and they recommend for her hormonal treatment. They recommend birth control. Seems fairly safe, seems like a good idea, but it actually might not be addressing the true cause of the problem. See, if you really think about it, what does the average American eat for breakfast these days? They eat cereal. Most cereals are simply refined carbohydrates that turn to sugar, the second you eat them. Even though they say they're whole wheat, they're still so processed and refined that once they're eaten, it's going to cause a big spike in sugar levels, and that's going to cause a big spike in insulin. So what do they eat for lunch? Typically, a lot of these kids are eating French fries, potatoes, macaroni and cheese, and for dinner, same thing. They have toast with spaghetti. Maybe they have a serving of vegetables, which is for some the spaghetti sauce, which is of course full of, high fructose corn syrup. Sugar. So we see carb, and then they also like to snack on crackers, candy bars, sodas. It's found that the average child before the age of 8 eats more sugar now than Americans used to 100 years ago in their entire lifetime. We've really started to increase our amounts of sugar as well as our refined carbohydrates, which is all going to lead insulin spike. And with this spiking, what we've seen is that we're going to create a situation where the insulin actually goes down or goes out and converts progesterone and converts it to estrogen and testosterone. So it lowers progesterone levels, it raises estrogen levels, and it creates a hormonal imbalance. So that's why in our office, every one of our new patients, when we do our initial lab work, we always look at insulin levels because we find this hormone is driving so many hormonal imbalances as well as weight gain. You have to understand, insulin's actually a growth hormone. Bodybuilders have found this little trick, so they've actually started using insulin to bulk up. This is really problematic for diabetics because many of the medications that some diabetics are taking actually increase their insulin levels, which helps lower their blood sugar, but it creates a whole cascade of hormonal problems. It's really important to understand your insulin levels and what it can be doing for your weight and for your hormones. I love this study. I think you will too. It says that the tissue of women with breast cancer may have 10 to 50 times the level of plasma concentration of estrogen. So what are they saying here? That breast cancer is caused because of elevated levels of estrogen. This is one known cause of cancer. What I really like about this study is that it says further, this suggests that estrogens are not properly detoxified and therefore will accumulate in breast tissue and increase the risk of breast cancer. If you think about this, what they're saying is that estrogen's bad, but it's really bad when it accumulates in the body and it's not detoxified. I don't think a lot of people have ever really thought that, hey, maybe cancer is related to our liver function, because isn't that the organ that's responsible for detoxification in our body? One of the primary drivers of detoxification. So this is, once again, the connection of functional medicine and understanding that estrogens need to be eliminated and detoxified from the body or can cause cancer. What's even great about functional medicine is that we now have the testing to evaluate estrogen levels. So this is a 21-year-old girl that came into our office. Her mother sent her in our office to have her hormones evaluated because she was, like so many, having problems with her hormones and problems with her cycle. So the top three on this top line here are the 3 forms of estrogen. We measure those. As you can see, 2 of the 3 are very high. See where it's red? 2 of the 3 are very high. Even more important are the ones below. Here, the 16-OH and the 4-OH. These two, research has shown us that they've been linked to causing breast cancer. Interestingly enough, the 2-OH here has been linked in research to show us that it prevents cancer. So as you can see, this young girl with the 16-OH and the 4-OH being high and the 2-OH being low, it's not a good scenario for her to be in. Even more important, the next step is what is called, the next step is where it methylates. If you look here at the bottom right, it's called it says methylation activity is very low. Methylation means that the body's liver is taking those estrogens and helping them eliminate them. In her case, it's not happening. So those estrogens recirculate in the body and become problematic. That's what I love about functional medicine. I mean, this is sort of the power of functional medicine, of really understanding not only what's happening, but why is it happening. And unfortunately for so many women, or I guess so many women think that by getting mammograms that they're preventing cancer. They're doing nothing but looking for cancer. It's going to be too late if they do detect it. This test that you see in front of you on the screen is a true preventative test, and I believe that every female deserves to have this test run and should know this test to understand this. With this information now, we know we can run this particular patient or put this particular patient on a specific supplement and product routine or program, I should say, to help the body suck down these higher levels and help elevate this 2-OH and the preventive levels so that we can do a true prevention instead of waiting and having to treat the disease. Recent research has come out and said that there's really 4 primary causes to breast cancer, but not only breast cancer, also uterine and ovarian cancer. They're finding now that the hormones are definitely a cause, but they're also saying environmental toxins are also a likely suspect in these types of cancers, as well as our genetics, but also our immune system and our immune dysfunction. So as we mentioned earlier, the immune system is what we think about. It's really the gut. With the gut, one of the things we want to understand is that if you look here on the far left, look here on the far little villi, they're kind of finger-like objects here at the top of the gut. Those are in the intestines. There, my cursor's working. Below the intestines is the blood. It's where the blood circulates. Everywhere there's an intestinal tube, there's also blood that follows it. So the object of the tube is to keep particles and bacteria, parasites, as well as, basically fecal matter from entering our blood. What happens over time is our intestinal systems become damaged. The biggest culprits to these are things like antibiotics or NSAIDs. Ibuprofen is one of the leading causes to gut damage that we know of. We also know that eating food that really isn't true food or things that have chemicals in them are causing damage to our gut. Alcohol, stress, pregnancy, all of these things cause these little tears in our intestinal system like this, which allow particles that aren't supposed to be leaving our intestines. It's allowing this intestinal matter to go down and into our blood. You can just imagine, if you cut yourself and you start to rub dirt in it and fecal matter in it and bugs in it, that it would obviously become infected. Well, that's what's happening on the insides of our guts. It's that these systems, these tears are starting to leak these toxins and these particles back into the blood system instead of keeping them out. When that happens, a whole cascade of responses start to happen. Our immune system starts to attack these particles just like they're viruses. What happens when you have a virus or a bug in your body, you get an infection of some sort, you have a temperature, your temperature goes up to try to fight the bug, you get inflammation, you get swelling in that area, reddening of that area. What happens in your gut? You don't really feel it or see it because it's on the inside of your body. But that swelling and that immune response start to affect not only in your gut, but your entire body. What happens is your gut becomes inflamed and starts to not absorb your nutrients. Over time, they say that this is one of the major causes of autoimmunity. Right now we're finding that 1 in 8, and this just breaks my heart, 1 in 8 people in this country are being diagnosed with an autoimmune disease. They're wondering why that is happening. We're starting to see that more and more people have food intolerance, food sensitivities. I mean, think about this. 30, 40 years ago, peanut allergies weren't even existent for that matter. I mean, very rarely, but now you see that in every school. I grew up, I never had heard of such a thing growing up. And really, I can only, growing up, remember one case of asthma. It happened to be my sister. No cases of ADD, ADHD, autism. Things have changed. They also say that this change in the gut can start to affect our blood-brain barrier. So these toxins, these particles get into our brains and cause inflammation in our brains. Then eventually the systemic inflammation where our whole body starts to ache and feel swollen. Here's some research that shows, well, I guess I want you to understand what this says. It says metabolic endotoxemia. What does that mean? Toxins inside of the body. What's that word there? Initiates, right here. Initiates obesity and insulin resistance. What they're saying in this article, in this research, is that endotoxins, the toxins that are coming from our gut, causing us to be fat. Obviously, we know that we eat too much food, too many calories. We know we're not active enough. We know that's still a cause, but what this is referring to in essence is that well, let's say you have somebody that's eating 1,000 calories a day and being active and they're not losing weight and they're developing diabetes. I'm seeing that in our office too. What that can mean in some of these cases is the person has a gut that's so damaged that it's leaking toxins into the body. If you read this article a little bit later on the first line, it says they're seeking an inflammatory factor on the onset of insulin resistance, which is diabetes, obesity, and diabetes. We have identified bacterial lipopolysaccharide as a triggering factor. I want you to see this study. I want you to look at this. This mouse on the left and this mouse on the right ate the exact same diet. This is what's great about being in a clinical setting with these lab rats is you can make them eat what you want them to eat. You can make them be as active as you want them to be active. Both these mice had the same activity level, ate the same amount of calories. If you notice here the difference of the size of the mice, the only difference is these two rats. The one on the left was injected with the toxin, and that toxin causes obesity and causes insulin resistance. They also said that mouse was more likely to have diseases. Look at this next study. They're saying that the gut-brain barrier, like I'd mentioned earlier, when the gut becomes damaged, it leaks into the blood, and that blood goes to the brain. That's the gut-brain barrier. It's how it's related to major depression. It's at the intestinal mucosal dysfunction, lining of the gut. When it becomes damaged, it increases the amount of toxins that go into the body. Then it says that causes leaky gut, plays an inflammatory pathophysiology of depression. This LPS toxin from the gut is related to depression. We're starting to see more and more of these types of things coming out in research. What do we do in our office when we look at somebody with a digestive dysfunction? We don't guess, we test, and we do certain testing. We look at if they have high CRP. I mean, every one of you should have this test, and it should be something that's right below your cholesterol levels. It should say C, reactive protein. They're finding that there's inflammation in the body. It's not just in the gut, but it's systemic, and it goes to the heart. It's the gut-heart connection. We also see things like homocysteine levels going high when there's gut dysfunction. We see low vitamin D levels. This is why so many people, despite vitamin D, can't get those levels up because they still have a leaky gut. Food sensitivities, autoimmune disease, chronic illness, infections, sinus, allergies, people that have bloating, diarrhea, reflux, gas, belching, skin issues, headaches, migraines, depression, anxiety. I could go on, but let's stop there for a second. Think about depression and anxiety. What do they give? They give you an antidepressant, which is a serotonin reuptake inhibitor. Where is serotonin manufactured? Is it made in your brain? No, it's actually not. It's actually made in your gut. 80 to 90% of serotonin is made in your gut. If you have gut dysfunction, you're not going to make those serotonin levels. Serotonin is made from your nutrients, from the food you eat. It's made from B vitamins, B9 and B12 in particular, and tryptophan. Think about this. We don't necessarily have an epidemic of deficiency depression medication. We have gut issues, serious gut issues going on that are causing these types of problems. It's unfortunate so many people are treated improperly. Systemic pain, like we said earlier, can happen also with this digestive dysfunction, nutritional deficiency, where if you have little white spots on your nails, cracking of your nails, ridges on your nails, those little bumps in the back of your arms, they can all be signs of nutritional deficiency and poor gut. This is one of the tests that we run in our office. This is a candida test or a yeast test. It looks to determine if your body is overcome with yeast. This is in particular in the gut. So one of the things that we see in our office is that in about 60 to 70% of our patients, they have this hidden yeast overgrowth in their gut. That means when the patient eats their food, instead of absorbing the nutrients, the yeast eats the nutrients. Now the patient starts complaining of fatigue, they complain of hunger, they complain of bloating, gas, they crave carbohydrates and crave sugar. Killing this yeast or getting this yeast out of the body or ridding this body of this yeast is going to be so important for people in regaining their health. I mean, oftentimes their symptoms can mislead their doctors into thinking or believing that they have a thyroid problem or a fatigue issue, when maybe it's really just undiagnosed yeast. Another test that we do in our office is a food sensitivity test. A lot of you are familiar that when you go to your doctor, they prick people with these pins, determine if they have food sensitivities. That's an immediate reaction. So that's what's called IgE testing. In front of you is what we call IgG testing. This means that after you eat the food, it can be up to 24 or 48 hours, even longer sometimes, for your body to actually have an immune response. I mean, you can tell from this patient's case, there's lots of reds on there, a lot of 3s, 2s, 1s. 3s are severe, 2s are moderate, and 1s are mild. What's important to understand is that this patient doesn't necessarily need to eliminate all these foods from their diet. That's not necessarily all the problem. I mean, really what the problem is that hyperpermeability, that leaky gut that we discussed earlier. I mean, when you have a gut that's damaged, it can leak foods through the intestines back into the blood and cause the body to have that immune response. When that happens, that creates that inflammation that creates that slowing of the metabolism and the fatigue and the overall systemic inflammation. Our job with this patient, for example, is to change his lifestyle and change his diet and heal the gut and fix and repair the cause of this over response so that he can live a better life. So this is actually just 4 months later. I mean, same patient 4 months later. I mean, if you look at that, you'll see that the patient's immune system is calmed down. It's at ease now. And that's extremely important, especially when you're dealing with patients that have autoimmune disease, especially autoimmune disease of the thyroid, that they get this immune system to be rebalanced. With this patient, she was suffering from low thyroid. She had eczema. She also had psoriasis as well as lupus. She had a whole host of autoimmune diseases that she was taking steroids for, anti-inflammatories, pain pills. What happens when we got that, or what happens when we get that gut healthy? I mean, everything in our life started to click. If you remember from earlier, we talked about the 21st century and how the environment's changing, the pollutants have changed, the pesticides, herbicides, stress, trauma, pharmaceutical industry, cosmetic industry. I mean, we're just being bombarded right now with tons of toxic stress. All of this goes through the liver. Our liver is a 4-pound metabolic powerhouse. It's responsible for over 500 metabolic functions. One of the primary functions of the liver is actually to help the body heal itself. So here's a good example. I mean, look at the far left. That's you. That's you when you were born. You're a nice, healthy baby, newborn baby. This is what your body is made up of, trillions and trillions of cells. What happens over time is these cells are attacked by things called free radicals. I think every one of you have probably heard over time of free radicals. I think you probably heard that free radicals cause cancer. As you can see over time, if these free radicals are damaging these cells, eventually on the far right, That's what you have. You have a cell that's oxidized, that's becoming more prone to cancer, that are cancerous. I mean, free radicals are like throwing rocks at your beautiful normal cell. I mean, imagine if you had a gorgeous 911 Porsche, throw that out there for my husband, and you started to throw rocks at that 911 Porsche. How would it change the exterior of that car, which would eventually affect the function of the entire vehicle? It would. I mean, realistically, this process that you see in front of you, this is the aging process. I mean, we start out over here healthy. As life goes on, we're exposed to these free radicals from digesting food. They can come from exercising, from burning calories, from toxins, from the environment, from our body's hormones, to metabolites of the hormones, the waste products. Everything in our life creates an exhaust, a waste. That exhaust and waste causes us to age. That's why people that smoke, that don't sleep enough, or under a lot of stress, they have more free radicals than others. That's why they age faster. I mean, you've heard some people age faster than others. Here's your answer. It's free radicals. What happens over time, these free radicals damage the cells. And if you look at the cell on the far right, I want you to think of something. This person, what would this person feel like? That's right. They're probably not going to feel very good. They're going to feel like crap. Also, how much energy would this person have? How's this person's thyroid going to be functioning? How's their digestion functioning? How's their immune system functioning? No matter how many hormones we give this patient, no matter how many drugs we give this patient's not going to feel well. That's what's so important to understand with our office, is that we don't just treat the symptoms. We want to ensure that the liver is functioning properly, getting rid of these free radicals that were reducing the damage to these cells so that the body can become healthier. I don't like the word anti-aging, but this is helping slow the aging process. Also, with our patients that have a lot of this damage occurring, we want to reverse some of that damage that's been occurring. What's interesting is the more damage you have in the cells, the higher your cholesterol is going to be. So I want you to think of something. Earlier we talked about that every hormone is made of cholesterol. Remember that? But about 90% of all cells in your body, one of the precursors to it is cholesterol as well. So the more damage you have in your body, the higher your cholesterol is going to be, because the body's going to try to fix those cells. If cholesterol is a precursor and damage is there, the body will push out cholesterol to attempt to fix it. Make sense? So let's just throw this out there. Listen up, guys. Question. This is an A or B. A, the body makes more cholesterol in an attempt to kill itself. Or B, the body makes more cholesterol in an attempt to heal itself. Tell me you were listening and you know that it's B. It's got to be B. I mean, your body's not trying to kill you. It's actually trying to heal you. I mean, really think about that for a second. So all this time we've been so terrified of cholesterol. I mean, there's a good reason why, because that's what we find when we look at arteries that are clogged. But why is it stuck in the arteries in the first place? Have you asked that? Like, why is it actually there? I mean, the only reason that cholesterol is going to be stuck in an artery is if the artery has inflammation, if it's damaged, and if there's free radicals that are causing damage to those arterial walls. If the arterial walls aren't damaged, there's no inflammation, the cholesterol is just going to hit the wall and fly down and keep right on moving and go along its merry way. What we're finding now is that inflammation is indeed the cause of heart disease. It's indeed the cause of cancer. This is what we're really more concerned about, is inflammation of these free radicals. When the liver gets backed up, I guess when it becomes bogged down, so to speak, because of the leaky gut, because of the toxins, because it just can't keep up with all that's happening to it, we start having troubles, and these toxins start to accumulate. We start having troubles concentrating. We become forgetful. We develop headaches, migraines. I mean, I want you to think about something. When you get a headache, what do you take? What do you take? I hope you say you get adjusted, but what do you take? You take a non-steroidal anti-inflammatory drug, right? An anti-inflammatory drug. So it's the inflammation that's occurring from the gut that the liver can't keep up with, that's accumulating in the brain, that causes the headaches. It is not a deficiency of Excedrin. It just doesn't make sense that we're just taking Imitrex and these other drugs to try to prevent headaches or migraines when truly we've got to get to the cause if at all possible. And that means improving the gut health so much of the time, so that when we can improve the detoxification of the system, then we can start to see the symptoms go down. Are you following me? I mean, we've helped so many people eliminate their need for headaches and migraine medication by looking at the function of their body. I mean, people who have an overaccumulation of toxins can start to have tremors. They wake up between the hours of 2 and 4 in the morning when their bodies start detoxifying. They can have an increase in allergies, skin issues, acne. Just like the gut and the liver, the health of those two organs can be shown by the health of your skin. Your skin's a direct reflection of your gut and your liver. I mean, I was just telling one of our doctors the other day, what you see on the outside is what's going on the inside. So over time, if the liver becomes too dysfunctional, we start to see the cholesterol go up. We start to see high blood sugars. We start to see an increase in muscle and joint pain. What's a side effect of a statin drug or a cholesterol drug? I mean, one of the main side effects is muscle and joint pain and muscle weakness. So I have a patient in my office. She's a medical practitioner, an ER nurse. She refuses to go on statin drugs because she believes that they lead to weakness. And that's why she thinks the nursing homes are so full of so many people, because 1 in every 3 Americans, like I mentioned earlier, is on a statin drug now, which is going to lower their cholesterol levels. Also, though, lowers an important enzyme called CoQ10, or a nutrient called CoQ10. It's really important. This is really important for muscle function in the body, especially that of heart contractions. There's even some researchers that are coming out now that are saying that, hey, these cholesterol drugs could be leading to more potential problems in health. So we have the ability in our office to measure liver function, measure toxins, measure detoxification markers. I mean, one of the biggest tragedies that I'm seeing today, especially in today's healthcare system, is that these toxins and these environmental factors are being completely ignored. I mean, if you go to your doctor and you ask them, hey, do you think toxins could be causing my thyroid problem? Or do you think toxins could be causing my sleep issues? They're going to look at you kind of funny. I mean, I want you to understand something. It's not because they're vindictive or that they're being deceitful or that they're being mean or dismissive. That's not it at all. They simply don't know. I mean, it's kind of like if you came to my office and said, hey, doc, I think I have an appendicitis. What kind of a surgical incision would you need to perform that? I mean, I'd look at you all kinds of crazy, because obviously you've come to the wrong doctor asking the wrong questions. It's really what it is. Most medical professions, obviously, they got out, they went to school, they worked very hard to help people, but they've only been taught what they've been taught. I've only been taught what I've been taught. So you can't be angry or frustrated with these people because they don't know these things. They just don't know. I don't want to pretend that I know everything as well, because, gosh, I do understand one thing. We help a lot of people, but I don't know everything. I mean, the reason we're able to help them is because we do a lot of digging and we're a little bit more open-minded to what true causes are out there and what the research is showing us. I mean, when you look at patients today, they're doing what they're supposed to be doing. They're taking their medication, they're trying to eat less, they're trying to move more, but they're still suffering. Every one of the patients that I see, I mean, they all tried very hard. It seems like, on some level, a lot of the people, by the time they get to me, they've tried very hard to be healthy. They weren't the kind of patients that just couldn't get their hands out of the Cheeto bags. I mean, there's so many patients that worked really hard. They really wanted to be well. They just couldn't figure it out. I want to go over this patient. It's Roxanne Lewis. With Roxanne, she came into the office initially years ago because her right hip hurt. She, with looking at her health history, holy buckets, she needed a lot more than just help with her hip. So we talked to her and said, we can help you with some of your issues in addition to the hip pain. And she didn't believe it. I mean, she had spent thousands and thousands of dollars and years of her life trying to get answers for her problems. I mean, over $50,000 of her own personal money.
I know with what I spent of my own personal money when I went to Mayo, I can easily see how that can happen. And if you read her testimonial here, she said, I wasn't able to sleep more than 2 to 4 hours without waking up. I was unable to go back to sleep. If you think about what we talked about today, what systems of her body are you thinking about when you think this? I mean, think adrenal glands and liver. That's what I was thinking, adrenal glands and liver. She says her hormones and emotions are all out of whack. Her menstrual cycle was 6 to 8 days long, heavy every 2 weeks. Of course, traditional medicine is going to say, well, if you're having a cycle every 2 weeks and they're 6 to 8 days long, that's a hormonal problem. And they were right, or almost right. It was a hormonal problem, but it wasn't really that her hormones weren't, I guess it was that her hormones were out of balance, but the problem, why they're out of balance so far is because her liver was so faulty. I was pretty sure that was happening. I wasn't sure though, because I don't ever guess, I always test. So we ordered tests and they came back positive. She started care and it helped. Thankfully, after 2 weeks of waiting for the testing, the results came back and showed exactly what we thought. Her body was actually not metabolizing or even eliminating estrogens properly. And after only working with her 2.5 months, she says that her life and her health are so much better. She sleeps the entire night, 7 to 8 hours uninterrupted. I don't know about you, but if you've ever been a person that hasn't slept for more than 2 or 3 days in a row, it starts to really take its effect on you. It makes you very depressed, anxious. It can really start to make you very emotional. That's what was happening with her. Just imagine the first night she slept 7 to 8 hours straight. Then she also said, my menstrual cycle is completely normal now. For the first time, I feel like I can conquer the world again. It's amazing. All this in just 2.5 months. The only reason we were able to do that is because the simple principles, again, we take out of the body what it doesn't need and put into the body what it does need to function well. So we took out those estrogens, the bad ones, and put into the body what it needed to help detoxify those estrogens. That's what our office is about. Like I said, real people getting real results. I hope by now, after watching this far, if you've listened this far, it's pretty amazing in the first place. But if you have, I want you to know I'd love to invite you to come into the office and talk to find out if indeed we can help you. What we're going to do is we're going to sit down with you. We're going to have our first visit. We're going to determine if you're a good candidate for our care. We'll sit down and talk with you. If we believe you're a good candidate, we'll then talk to you about what testing I recommend. I typically initially only recommend one test. First test can be anywhere from $100 to $200 or so, usually about $186, depending on what we're going to need. I'd also recommend you bring any of your old lab work with you as well. Not that it's going to reduce any of the testing that we're going to do. It's just going to give me a better understanding of what additional testing I may need to order that first visit. We're going to send you out of the office with that lab work. It'll be about 6 or 7 days, and we'll get the lab work back. We'll call you back for your second visit. On your second visit, I'm going to review your lab results with you. I'm going to let you know if indeed I can help you, if I feel like you're safe to treat, and if this is the right place for you. If I can help you, we'll go over what's wrong, how long it's going to take for me to help you, and then also any expected costs as well as additional testing I'll need. I will need additional testing, but the first test will help me understand what additional testing is needed. It'll help give me a roadmap as to where to go. Now, one of the great things about our office is that we have several different options to make things more affordable for our patients. What's important to understand is that we're here to help you, and part of that help is to figure out the best way to make this affordable for you. People are always asking, well, how much is it? Well, first off, it's hard for us to say exactly how much it is because I don't know you. I don't know what's wrong with you. It's kind of like asking someone to remodel your house, but they don't really know what needs to be remodeled. The first step for us is to figure out what's wrong and what we're going to do to be able to help you. I can tell you that our care plans of care can range anywhere between $800 and $5,000, just depending on the length and the severity of your condition and how long it's been going on. What I think what's important and what I want you to understand is people come and refer to me and refer to this office, and we've built this business because of the difference we've made in their life. I mean, we've changed their life, and that's what I'm hoping you understand. This is not some gimmick. It's not some scan. This isn't some quick by night, take a pill and heal all your ills. This is real care for real people. We find natural solutions, long-term solutions for people to get to the root cause of their problems and live their best life. When you transform people's lives, they'll do anything to help others do what they've done as well. My last slide is, if you can't change what's going on, or you can't change what's going on around you until you start changing what's going on within you. If you continue doing what you've done, you're going to continue getting the same results. I just ask that you venture out and you take that first step and you schedule that first consultation with us to find out if indeed I do believe I can help you. And I promise, if I don't believe I can help you, I'll refer you to somewhere else. Thanks for listening. Have a great day. God bless.